my dad died 5 years ago, and we tried to get my mom to move up and live with us here in New York, and she just refused. She wanted to live in the Keys, in the house where she and my dad spent many years together. After the third time she fell, and they didn't find her for a couple of hours, I said, Mom, we have to do something. We can't just let this keep happening. So I hired these women to live with her in shifts, which of course she hated. So she's got a stranger sleeping on her couch. And you know, they're stealing my garbage bags. Mom, they're not stealing the garbage bags. At TED Med, I ran into a gentleman named Eric Dishman, who is part of an organization, it's a joint venture between General Electric and Intel. And one of the things we're working on is called the Magic Carpet. So it's a carpet you install in the home of your loved one. It doesn't say good or bad. It just says, this is how Rick's mom walks when things are okay. And then all of a sudden in a day where her balance is off, her gait is off, or she hasn't touched the carpet until 10 o'clock in the morning, and I know my mom always has coffee at 8:30 in the morning, the system sends me a message. So there's no cameras, no invasion of privacy, nobody's sleeping on her couch, nobody's stealing her garbage bags. But the product is not out. It's still in research phase. And then I found out about things like this. This is the Jawbone, the Upband. I know that Nike is here and Body Media is here. There's all these devices now that Kevin and Gary are going to talk about later that do kind of the same thing. They create a baseline. So every night now, my son asks me, Dad, did you walk your 10,000 steps today? It measures my sleep at night. The idea is that my friend Dean Ornish told me that a lot of doctors believe right now we're spending 18% of our GDP on healthcare. And if you look at the trend line, they're saying by 2025 it's going to be 40%, which is obviously insane. We all know we're paying more and more every month for our insurance. The idea is that 3 years before one of us is in an ambulance on the way to the hospital, our body's been giving off all kinds of signals and signs and data, but we've not been paying attention to it. So one of the ideas is that if we were wearing devices like this, which are actually kind of fun, my brother and I compare our sleep at night, my kids ask me if I made my goal, the gamification of health, instead of dealing with it when you're already sick, but doing it in the early stages, makes this maybe this is a way of sort of addressing the healthcare situation.